Hi everyone, my name is Mehr and I am a third year medical student at Comp Northwest. I'm here today to join AOCPMR to help show you what is in my rotation bag. So now that I'm a third year, as you've probably experienced, we now go through clinical rotations. So instead of being in our pre-clinicals where we're behind the desk all day doing lectures, we're now out in the hospitals and learning with the other doctors and trying to see how we can provide great patient care and also understand what specialty we think is the best for us. And as I'm doing this for AOC PM&R, it should come as no surprise I am interested in PM&R, but as my first rotation, I actually have psych. So I thought it'd be fun to show you what's in my medical school bag, as I love what's in my bag videos. So come join me and see what is in my medical school bag while I'm doing this rotation for psych and also my first ever rotation in general. So the bag that I have is actually a Longchamp. Fun fact, I got this when I was a senior in high school, so in 2016, and it's almost been 10 years since but I feel like it's still in pretty good shape, and I think that this is one of the best investments that I bought. But like I said, you don't need a fancy bag like this. I just already had it. A nice bag would be either like a backpack, which is more probably ergonomically better, or just something that's able to carry a lot of your stuff. So any big bag will do. It doesn't matter, again, the bag, just whatever that you feel most comfortable bringing into the hospital. That has one giant pocket where I put all my stuff in, which is probably not the best system, but I'm just gonna go right in. I haven't really checked what's in here, but I do want to preface by saying I usually also have my lunch in here as well, which I'll put into the hospital fridge as soon as I get there. So I like this bag a lot. It holds a lot of stuff. But the first thing I see when I go in are my glasses case. So these are just my glasses. It's nothing super fancy about it. They're probably a little bit dirty, but these are just glasses that I wear when, I'm reading something. They look a little dorky, but they're the glasses I wear when I'm reading something, and it just kind of helps my eye strain a little bit, as everyone knows what glasses are. I also have my iPad, which has been really helpful with patient interactions. Like just recently we did the ham scale, and because it's been a while since we studied that in school, it was nice to just pull it up really fast and kind of see what's going on while we're talking to the patient. It's also great during pre-rounding because it's good to just kind of see like some information and look things up if I'm not sure about specific medications, or their interactions. So that was pretty good to have as well. So I do like having my iPad. If you have one, I think it's great to bring on rotations. The next thing that I have in my bag are my headphones. I don't really get to use these as much, but if I have some downtime or if I'm walking into the hospital, I like to have them on and just play some music to get myself excited for the day, and also just to pump myself up, if that makes any sense. I love music. I think it's one of my love languages, so headphones are always a must for me. I have in my bag is a stethoscope. In psychiatry, we were told to not wear ties or wear stethoscopes around our neck because they can be a safety hazard for us, just because, patients could do some things that might harm us. So it's good just to not have anything on us that could be used as weapons. So I always have my stethoscope. I haven't been using it too much for the reason that I just mentioned, but I have it in my bag just in case we have to do a physical or something. The next thing I have in my bag, I actually have a small fanny pack in my bag with a hair clip on it because you never know when you need to put your hair up. This is nice because instead of having to take my whole bag, I can just take this little bag out, and it has like all my essentials on it. It has like my wallet, it has my keys, it has my Invisalign case, it has my lip balm. So all the things that you would want. So if I'm like going somewhere after I get off, or like just grabbing something from the cafeteria, it's nice to just bring this instead of my whole bag. So I really recommend this. I actually saw one of my friends do it, so I copied this from her, thanks to her. So I definitely think that this is a good idea to have. The next thing I have on my list is a little small notebook. This is great to have too, just because if you're, doing pre-rounds or you just want to make some notes throughout the day, it's really easy to just like flip it open and just write a couple things down that I like to review at the end of the day. And it's just something that I think is a little small, and it fits in your pocket and it doesn't carry too much weight, just because, yeah, and it's so cute and I love the color. And I think that this is something that's awesome to just, have as a necessity if you need to write something down. The next thing in my bag are my sunglasses, which I wear when I'm driving. I think that's self-explanatory. Next thing I have in my bag is just some papers. This is stuff for a MSE, so it's kind of like a template on how to give a good mental status exam. So for our patient visits, For our objective portion, it is something called the mental status exam, and these are just a lot of questions to ask your patient to see how they're doing with their cognition, with their thought process, with their appearance and their mood. So the resident I was working with actually gave me this, and it's a nice little checklist to kind of see what's going on and what questions to be asking your patients. And then she also gave me another one on like age, gender, how are you doing, how did you sleep? So this is really helpful too. So it was really awesome she gave this to me. I do recommend, if this is a new rotation for you, maybe printing out something that does kind of guide you along your thought processes of what you're gonna ask a patient if you were giving a interview with them. So this is really helpful. And if you are ever confused, just ask for help and ask maybe the attending or resident that you're working with if they have any guidance or tips or anything. So that was really helpful to have during. Next thing I have in my bag are mints. I'm terribly addicted to coffee. I'm pretty sure everyone in that medical field is. So I like having this because I hate having coffee breath or like any sort of breath. It's my biggest fear. So I love mints. I think they're a necessity for me. Next, I have my AirPods. Like I said, music is my love language. So I like having my AirPods if I can, if I'm just walking somewhere, if I have downtime, or if I'm like walking into the hospital. It makes your day. It makes you feel like the main character. And then I also have my Anki remote, which I do love Anki. I know some people don't like it, or some people only do Anki. I'm somewhere in a little bit of the middle of both. I try to do my do cards every day for this rotation, which is something new I'm trying out. And if I have downtime, I will try to do Anki. But like I said, I'm here to learn, and I try to do my best to be present in the rotation. So I truly try not to study if I have time to just learn and take in the rotation. So I really recommend just trying to give your best foot and trying to be as involved as possible. But of course, if there is downtime, Anki all the way. Couple pens. I am a firm believer that the right pen is like a perfect shoe that fits. You need to have a pen that you are in love with because it just makes the whole writing experience way better. So for me, I actually have this pen that I stole from my mom. She's a nurse, and it just looks like this. It's like, writes really well. I wish I can tell you the brand. I can't, but it looks like that. And this other pen I actually made kind of in a Frankenstein way. So this is the Sarasa Clip Zebra pen, and I actually filled it with the Pentel 0.7. So I love the hold of the pen, but I just changed the ink because the ink is not as good. I'm probably giving way too much information about pens, but if anyone's interested, let me know. So I have like a bunch of different colors. I'll write black. Okay, I'm getting way too nerdy about this, but that's my Frankenstein concoction. Next, I have just also some lip balm. My lips tend to get really dry in the hospital, and also like my skin. So I like to just have something with literally like minimal to no cover, just to have something that rehydrates them. So I really like this brand. It's the Summer Fridays. Oh, you can't even see it. I feel like a YouTuber. It's the Summer Fridays and the pink sugar. Next, I have this small pouch that I carry in here. My bag, as you're starting to see, is just a bunch of small pouches all in one. But I have this small pouch, and in here I just have more gum. I also have some hand sanitizer, and because we're always like washing our hands, I like to carry like hand lotion with me. This is the one from Trader Joe's. I've been using this a lot more than I thought I would. It's really nice because after you wash your hands, and sometimes I get like really itchy, or I just kind of have like super dry, like a super dry sensation after. This is nice to have to quickly put on and just like rehydrate my skin when I need it, especially in the hospital, because they do be getting dry. If I'm able to rehydrate them, I will. Everything that I have in my bag is now completely empty. I hope that this video was somewhat helpful for anyone. Like I said, I'm on a psych rotation right now, so I'm not carrying as much medical equipment as maybe some other rotations are, but I just thought that this would be a fun way to kind of see what it's like for a transition from second year into third year. And whatever stage you are right now in your medical journey, I just want to let you know that you got this, you can do it, and there's always going to be a better day, and to just keep a positive mindset and just know that you are where you're exactly supposed to be. So thank you so much, guys. Once again, my name is Mehr, and thank you so much, AOCPMR, for having me.